I'll start bringing them in.
Is it possible to have them put in the chat their title, community member or donor, like you said, just so we know the audience?
We can certainly do that. Yeah. Hello, people, as you're coming in and over on Facebook as well. We won't be able to get them in the chat, but if you just want to pop into the chat box, everybody, and let us know who you are and where you're from. So, good morning, everybody. It's not morning anymore, so hello, everyone. I'm Andrea Hugenbeck from YWCA Greater Green Bay. I'm super excited to have you here with us today in our regular Stand Against Racism monthly series. So whether you are here in person or watching after the fact, welcome and thank you for joining us in our mission to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all. So as you know, if you're here, we do this monthly webinar series. We do have kind of the rest of them from previously in the year up on our Facebook and on our website. So you're welcome to check out all of those ones from previous in the year and also to register for new ones that are coming up later in the year. And also I want to bring your attention to, we have 2 extra special Stand Against Racism webinars coming up this week as part of our national campaign for Stand Against Racism as well. So I would invite you to join us for those webinars on Friday afternoon. We have a 2 o'clock session and a 4 o'clock session. 2 o'clock is going to be really connecting racism and public health and why those things are sort of said in the same sentence and what a public health approach to eliminating racism would be. And then at 4 o'clock, we're going to be talking about connecting the data that we have around racism to policy making and how that works. And we've got some really excellent panelists coming up later in the week as well. So very excited for those. Please check them out on Facebook or on our website to be able to register for those as well. So excited about that. We also have a campaign happening Thursday, Friday, Saturday, Sunday this week to go along with our national campaign for Stand Against Racism to take selfies. So if you are kind of interested in participating with that, we'd love to have you. You can stop by our front desk to pick up a sticker. If you've already got one in the mail, that's fantastic. To be able to take a selfie or take a photo of your sticker out there in the wild somewhere and post it for us on social media. So for those of you who already have your stickers, thank you. We're excited to see those happening. If you'd still like to join, there's still time. Give us a holler and we can make sure we get you a sticker. So those are kind of the announcements for today. So getting into our webinar today, we're super excited for today's webinar. And we're continuing our series on COVID-19 and the unique impacts of COVID-19 on our different cultural communities, and also the unique attributes and assets of our cultural communities in working through this global pandemic and the way that people are sort of dealing with and surviving and thriving through this very interesting time that we have. So very excited today. And we have 4 really fantastic panelists. So Candi, hello and welcome. Do you want to introduce yourself? Give yourself the 3-sentence introduction.
3 sentences. All right. Candi Cornelius. I am the prenatal nurse at the Oneida Clinic. I also help moms with breastfeeding. I teach several topics to community, mainly families. I'm part of several different groups throughout the community. I work part-time for NWTC in the nursing program, and I reside in Oneida, and I'm also from the Menominee Nation.
Thank you. And we have Tanya. Hi, Tanya.
Hi, my name is Tanya Lopez Martin. I work for the Oneida Family and Child Education Program. I am from the Pueblo of Pewaukee in northern New Mexico. My husband is a member of the Menominee Nation. I also work part-time for Parents as Teachers out of St. Louis.
Thank you so much and welcome. We're so glad to have you. Next, we have Randy. Hi, Randy.
Saguli swagwek de ha hungot ni yongets wages kliwagi ni wagitolot ona yuri aga ne bagadu hunjot kale talong kuan ne dok nage de Kelley hunya ni he jit nyang wale hot oni yuri ag. So my name is Deha Hungot in my language, and I'm from the Bear Clan, and I from the Oneida Nation here, what we call the place of the bountiful ducks. And I teach our culture and language. Been involved with the revitalization of our longhouse here for over 40 years now, and have been given a title as a Bear Clan faith keeper as well. Well, recently got rehired at the Oneida Culture Heritage department as an archivist, language and culture archivist.
I hear you managed to be retired for a very short period of time and that it didn't agree with you, maybe.
Well, just part-time. Yeah.
Welcome and thank you so much for joining us. We're really glad to have you today.
Yeah.
And last but certainly not least, we have Lance. Welcome.
Hello. And I don't think Randy knows the word retirement anyway, so. But Lance Paradise Kelley, member of the Muskogee Creek Nation from Oklahoma, along with Shoshone Paiute from Nevada. But living here in Oneida for a long time, married in, so definitely a part of this community, taught at the tribal school for a long time, but currently a full-time instructor here at NWTC, and having some contacts around Native country involving, all these issues that we are facing even before, COVID. So definitely I'll kind of touch upon that a little bit. So thank you.
Excellent. Well, again, thank you all so much for being here today on our panel and helping our community to kind of understand and see some of these pieces of how COVID-19 is impacting our different communities differently and how our different communities are really responding differently and some of those cultural assets as well. So to kind of kick things off, can we talk a little bit about how has the pandemic really impacted you? How has COVID-19 and changed your life?
Kind of set the mood. Basically, I'm from the clinic, so kind of know the statistics, kind of know where we stand within the state with, amongst other nations. Pandemic hit us obviously in March 2020. Our clinic, our Oneida Community Health Center, was real fortunate to keep the doors open to well patients, which we find is, obviously beneficial and needed. I was so happy because that's my population. I was mom and babies. So still seeing pregnant women, still seeing babies for well exams. I found myself, I usually do one-on-one with parents. Instead, it was obviously due to social distancing and all that. It was mainly phone calls, mailing them stuff. But really for the first 6 months, it was basic needs. They were really struggling financially, emotionally, spiritually, anything, but everything was just kind of, their life was basically, destroyed either by loss of job or we've seen an increase in homelessness because people who allowed them to sleep on couches couldn't. So then, we had to deal with that population. But real fortunate, like I said, to have the clinic still open their doors to say, well, people come in, let's keep those people healthy, moms and babies, really important. And those providers really fought for that. Other clinics weren't as fortunate. We're a pretty large clinic where, like the smaller ones did shut their doors, temporarily or permanently, or some the funding and stuff were closed. So from a health perspective, we were real fortunate to still see our patients. Number wise, we have to understand that the Oneida Nation resides on 2 counties. So if we look at our population, I also have to dive in and get a new hat because I started contact tracing, which is basically notifying families. I didn't have to start that. The other staff was able to manage that till about September. Then I was kind of thrown in, trained real fast. The first family I had, one gentleman tested positive. He had 10 contacts. That's 10 calls, 10 interviews, 10 follow-ups. and that's pretty much a lot of our community. The grandparents have their parents, and then the parents have their children. So it's a multi-generational household. So a lot of education. I felt really good in that role, just because I knew these people and they were scared. I was a community member, so I'd call them and like, hi, my name is Candi, and oh, you're such and such's daughter, or who's your grandma? I'd kind of get that, and then they would know me. I've been working for the tribe over 10 years. So I was really fortunate, and I felt, that I was able to provide the families with good and accurate information, because there was so much out there that they, were scared. So from September to December and up till now, I'm still doing contact tracing. Had to learn about the infrastructure of an incident command center, which we turned into. And then December, we started the vaccinations. So far now, our vaccinations were about in the 5,000s as far as, and that could be me receiving both, or it could be somebody just starting the first. So we have about 5,000 people within the community, and we had people traveling from Milwaukee all over the place, because we were very fortunate to get a large amount of vaccine compared to neighborhood counties. We're only given, say a handful, and we were given, boxes of vials. So that's also real fortunate for us too. And then slowly the message is getting out there. People are trying it. People are seeing that it's okay and safe. And we're still continuing with vaccinations until basically they call it demobilize, when we feel, that we basically kind of hit the max of people. But when we talk about Oneida, so we did contact tracing for anybody that resided on the reservation. So when you look at our fatality rates, we only had 9 deaths. Only doesn't seem like it. I mean, that is a significant number. But one person had said like they just dreaded to read our Oneida newspaper because it turned into like an obituary page. Because not only were there 9, but those were the only 9s that we keep track of on reservation land. We had Outagamie, Native members enrolled Oneida, and then we had Brown County, and then we had Oneidas that live all over the place, in different states that the obituaries were tracked in the Oneida paper. So if you look at their numbers, they're like, oh no, they're not doing too bad. You have to remember that we expand over a real large area and out of state. So I think we reacted appropriately. I think we're moving in the right direction medical wise. I'm back to kind of my old job. I'm doing one-on-one with moms. I'm teaching virtually, which was really a struggle. Childbirth education. I had a lot of props and how do you show them? And, I had my breastfeeding class last night, and it was so hard for me because I'm right in there with moms, holding babies and doing all that stuff. So COVID in the beginning was really, really hard for me. So from a medical perspective, that's kind of where we're at. And I feel, we made good gains, and hopefully, we'll get better.
Yeah.
Well, for myself, when COVID first happened, we were like, as a school, we were like, how long is this really going to last? Like, really, everybody thought it was going to be about 2 weeks or so. Then we were going to get back to our normal scheduled lives and continue on. And then the dates just kept getting pushed back further and further. And we started hearing all of the deaths or the effects that people were having due to COVID. And I feel like this has caused a lot of people, and not just in our Indian country, but people all over with so much anxiety, not having that face-to-face contact, or not having that that personal connection with people has caused people to become anxious, depressed. They feel isolated, and now we're seeing that children are afraid of being in crowds. They're afraid of being around other people because they haven't. We had a lot of children born within this period of time, and those children don't know a whole lot of people. So they're really, really like clinging to their moms and their dads because they're feeling the anxiety that's happening. So we had to start doing all of our home visitation and all of our preschool classes all via Zoom. And although that was really hard, it worked out okay. We did have to search and locate lots and lots of resources because, like Candi said, people were losing their jobs. They were, needing food. They were trying to figure out where they were going to go, how they were going to do this, not wanting to leave their homes. And so that was such a huge thing, and trying to ease people's minds that, we have to follow these protocols and do what we're supposed to do in order to make sure that our families are safe. I know that the families that I work with and myself, we all are very anxious in getting back to being face-to-face. I don't feel with the new babies that have been born or the new families that come into our program, we don't have that attachment or connection as well as we have with other families that have been in our program or in our community for a really long time. So even myself, by the third day in, I was a mess because it was not my normal routine. We require so much routine, and children need that routine as well. So to not have the routines is huge. It's become troublesome for a lot of people. So I have seen a lot of families, a lot of parents going on like anxiety medication or seeking out services for like counseling services because they're feeling so depressed. Maternal depression is becoming higher because people don't have that, moms don't have that outlet in as much anymore. They don't have that support. So, and only having one person in a delivery room when they're used to like having like the moms and their grandmas and the dads of the babies, now they're only allowed to have one, and that's caused a lot of anxiety as well. So so yeah, that's one of the ways that it's impacted us.
I'm getting the
Paper, rock, scissors.
I'll go next. I'll come from a little different perspective. I mean, first, personally, I think as Candi and Tanya kind of talk about their own personal situation, but definitely a life at some level, a life-changing, situation that jokingly I kind of say that, wear a mask. I mean, I don't like wearing it, but I do. And I see the importance of it. And moving forward, I think as a society, we're at some level, we're going to continue making these changes. And, with the plexiglass at places and the social distance, it was kind of ironic. I was in Thailand on a trip with the NWTC last January, and I was 2 days before we left, and I heard the word, virus coming out while I was in Thailand. But also our students noticed that in most Asian cultures, they wear masks, and they have been for a long time. And part of it, pollution, you got large cities, environmental issues, but also they've faced some of these situations in the last 20 plus years. So, here in our country, definitely new politically. I mean, socially, that's what I do in my classes. We talk about this, wearing the mask, a simple thing, and what it brings, and the debate and the discussion. So you have that. I was fortunate enough, I remember that night when basically, Rudy Gobert, NBA player, shut down the world. Watching, he touching those mics, and then 2 days later, NBA shuts down and everything else just tumbled. And I was in Oklahoma visiting my mother, so luckily I was there for a week, got her situated, and she lives alone, so she kind of, at some level, has been isolated for a long time. But definitely, and being very fortunate to see her throughout the year. When a couple times I've gone down there, I got rapid testing, just make sure, all that stuff. So that from a personal level, and I'm not going to talk too much about, locally, and Candi does a great job. She's in there talking about this stuff, but from a native country, I mean, definitely every tribe's a little different, 300 different reservations facing this situation. And we're very fortunate here in Oneida having the resources, where in some places, including my tribe, they just don't have the resources. They don't have the clinic where, or the, you know, what Candi's doing. So it's a wide spectrum. My tribe, basically, they shut down. I mean, no one was allowed to go anywhere. There are places in South Dakota where they shut the roads into the reservation, and it became a political. And you had, you know, state roads shut down and checkpoints. So you had all kinds of stuff going on as far as that's concerned. So a lot of different situations coming from Indian country. Still today, now you got the economic question. You know, a lot of these tribes had casinos, some did not. You know, every casino closed down for a month at least. Now they're getting back into it. And then you got federal money involved. So you got a lot of stuff going on in that regard. So I'm just going to leave it at that. And then let Randy speak now. So
yeah. Well, what was the question now?
How has the pandemic impacted you? How has it changed your life?
Oh yeah, well, I lost my job, and that was a big thing, a big issue with a lot of tribal members, because our funding is contingent on that gaming monies. And when our gaming shut down, everybody that was, tribal contributions, they got let go, you know, and that was quite a shock, you know, especially with the job that I do. And so within my family, we counted over 20 of our family, immediate family. That's just from my mom, there's like 105 or so. Of those 105, over 20 contacted the disease. 2 of them ended up in the hospital. One was really bad. Well, both of them actually. And because of the things that I do, and I've come to know that there's medicines that are out there, you know, and that's something I've been learning all my life, pretty much almost, and got memories of my grandmas, my grandpa, you know, going out and picking medicines and stuff. And I was real fortunate in having an Ojibwe elder from Canada come down that I've known for over 30 years, who knows a lot about medicines. His father got an honorary doctorate at one of the universities up there. He was a medicine person. And this is his son, and he's this, phenomenal knowledge. And we had him down here for a week in 2019, June. And so I learned a great deal from him. And I still have contact, even with COVID. We talk from time to time. And so, I was doing classes, you know, when we brought him here. So there's that information was getting out there, but at that time, COVID wasn't here yet. And since it's came though, is that this elder shared with me the medicine, you know. And so we're fortunate that we have an area where this tree grows. It's the tamarack tree, and we use the inner bark of that and make a tea out of that. 2 gallons of it, and a number of my family members, you know, took it, and a number of community members heard about it, and because of an injury I had to my shoulder, I wasn't able to. Had surgery in November, so I couldn't get out there anymore and harvest it. So I had one of my nephews take people out there, knew where that medicine was growing, that tree. And I think it helped. I know my sister-in-law tried it, but couldn't finish it, and ultimately ended up in hospital because of it. But everybody else that used it, they didn't go to the hospital. You know, so. You know, that's what I've been busy with this since COVID, you know, since last fall when it really hit, because my mom had it. You know, she's 87, 88. Oh, crap, I forget. But she's an elder, and she got it. So I went and got the medicine. My brother got it, and his family. So we went out, told them where to go, and we picked that medicine. And so that's something that some of that cultural knowledge, you know, that's coming back here in our community that I've been involved with for over 40 years now. So it really had a big impact on our community, what it did to our community in terms of, you know, shutting it down. And we were pretty much isolated here for a year. We didn't have hardly anybody come over for that whole year. And the only place we went was to get necessities, a grocery store, you know, gas station, and mask up. Use that hand sanitizer all the time. My hands are all chapped up. And we had a couple of close calls because family members had it and we didn't know it and they didn't know it at the time. And 3 times I had to get tested, me, my wife, and our son who lives with us. And fortunately, they all came back negative, you know. So it's been quite the year.
So that's a really great segue into our next question. We've mentioned a couple of things now about kind of more intergenerational families, having a really tight-knit community. What are some of the ways that race and culture have really intersected with COVID-19? What are those kinds of pieces that are really different about being Native and your experience that's been with COVID?
Randy, you're up again. I'm gonna call him Uncle. He's my uncle. Go ahead, Uncle.
Well, I think one of the things, you know, is that our community is so close-knit. It's a real close-knit community. It's like that with all communities. We like to congregate. And that really threw a big wrench in that, you know. And people were still doing it though, and still, you know, getting that COVID, you know. So it was really hard to get that into the community's, I guess, habits, you know, of trying to stay away from each other and do more phone calls and stuff like that. And, but I think you know, we have a history of our ancestors going through things like this. If you look at our history with the contacts of the Europeans, I mean, that's fresh in our memories, and that's something that gets passed on from generation to generation. And it triggers, I think it triggers people too, because like in my family, you know, we lost family members or some of our relatives in the past because of, you know, the different diseases that came from across the ocean, you know. And so there's I think there's some ignorance still with that as well. There's an attitude with that, with this disease, you know, that is not real. I think that's something that's out there in our community, and you know, we've had contact with people like that. Yeah, I don't know what else to say there.
Just to expand on that, like he was saying, we're family. He's my uncle, and I have 8 other. My dad is one of the 10. So you can imagine our gatherings, and we had none in 2020. My grandma's birthday, we would have these drive-by, you know, kind of parties and still kind of make it work. So it really made, and I kind of was in awe with that. Like, I didn't think of anything like that. And I would hear like, we're going to do this parade, we're going to do this drive-by. Uncle Randy had a drive-by retirement party, throwing prizes at him and clapping hands or elbows, you know. So it was really being creative, and I was really proud of our community members. Like he had said, there are some, you know, against it, you know, still like Western medicine has done me and my generations wrong. I don't trust the vaccine. I don't trust the healthcare system. And I don't know what's going to change their mind. I've grown up in a culture, Oneida culture, and as a traditional person. So, but I also know that the combination of both is needed to survive in this modern society. So all I can do is provide accurate information, be a good role model. And like I said, our community is close-knit families. We really, I do this presentation and I say, we used to live in longhouses. I tell my niece this story. If we lived in a longhouse, it'd be all of our siblings and grandma and grandpa. There's like 15 of us that would live in this longhouse, extended family. It takes a village. That's how we were raised, and that's the type of people we are. And then we had to go away from that, and COVID even made it worse. you know, that I knew I would call elderly people in their home and they'd be alone for months. You know, they wouldn't even have contact with anybody. So that was really hard, was that taking that extended family away, or, you know, trying something different. And another thing too is we found funerals to be very tricky. There was a drive-by funeral, well-known, what was his title for Gordy McGlester? He was an archivist, was he?
Yes, yeah, like that. He worked a lot with gathering elders' stories for a number of
Yeah.
years and recording that, and just a wealth of knowledge there.
Yeah, so we lost him, and they did this really nice tribute to him with large pictures, and the family was sitting outside the Oneida Turtle School, because everybody wants to go and support the family. You know, we want to support each other, and I'm sure that's in any society, but as Native people, we want to be there for our friends and our family, and we couldn't. So I think the deaths and the funerals were really hard. We couldn't have our traditional ceremonies in the longhouse anymore. Somebody tried to do the traditional funeral, and it turned it into, there was like over 20 people that had contracted COVID. I mean, it just, you kind of, you know, COVID went to the second burner, and I'm going to be there for my friends and family no matter what, you know. So those type of struggles and conflicts was really hard. But I know overall the deaths in our community and the lack of access in family, friends, and our traditional ways.
Yeah, there's like, just want to touch on that too, is like some of the elders. See, we're an isolated community here, Oneida. We came here in 1820s, early 1820s. So all our relatives are still out in Canada and New York, the other Iroquois people. And so we've had to travel out there quite a bit. And they've come out here quite a bit too. And one of the things that they talk about is that we have these two world views. You know, we have ours and they have theirs. And because of modern technology, medicine, and everything, is that sometimes we have to use both. And that's something that they really stress, you know, is that like this disease here, it's not from here, you know, but there's a cure for it. And we're fortunate in having people who are like medicine people that have that as a gift to bring that forth, eh? But at the same time, with all the modern research and everything that's going on, they have medicines too, you know, that we can take, you know, to help us with dementia or leukemia or whatever. But at the same time, we have native medicine. And so what they're telling us is that use both. You know, they'll enhance. And maybe you won't need as much chemotherapy if we use our native medicine. So they'll work together. Yeah.
And just to continue on that, your initial question, I mean, especially in the first several months, you saw the high rates of brown and black communities. I mean, Latino communities, I mean, black communities really, and native communities. And native communities still have the highest rate of per population regarding COVID. But, you know, because most of those communities, you have cross generations living together, as, you know, Candi and Randy's talking about. And I mean, that's really what some of the core and the type of jobs that they're doing, you know, working in the around here, the meat packing places, you know, restaurant businesses. So those type of jobs, they had to go to work. So you had affecting, you know, those groups of people more. But, you know what Candi said about funerals. I mean, that was tough. I mean, I mentioned this to my friends outside of this community. I went to Gordy's and Chaz Wheelock, another one that was at the Longhouse. I mean, that was tough. He goes back to, you know, my wife's family a long time. And, you know, and then I went to a funeral in Oklahoma around Christmas, and it was the first funeral that they had a funeral, but it was outdoor, but everybody was social distance, masks and all that. I mean, at least there was some element of that singing and all that stuff. We weren't there, but at least we did that. And, you know, and the uncle died of, you know, COVID. So, you know, I don't know the numbers, you know, but I suspect almost every Native family is affected by COVID somehow. And I know, you know, once again, what Randy's talking about, the boarding school experience, the boarding school trauma sometimes is referred to as almost every Native family has a family, probably now one or two generations ago now, probably farther than that, but we were impacted by boarding school. Our language loss, culture loss. I mean, you go down the list here. So you have a lot of that similar to what's, a little bit of this, the isolation and the loss. And, so it hasn't gone away regarding, and most of the tribes out west, I mean, they're very isolated. I mean, so their communities are tight. I mean, my cousins, I mean, they didn't leave the reservation. I mean, we're talking 90 miles to the nearest town. Oneida is very fortunate to live, 5 miles, part of the Green Bay on the reservation. So, people could get up and go to the store, but some places they couldn't do that. Navajo Nation got hit the worst. The Pueblos of New Mexico, Tanya's from, I mean, they're all shut down. I mean, literally shut down. You couldn't go into the Pueblo. There was guards, security guards, even your other tribes. It didn't matter. You had to be living in that community, and only certain days they said, okay, certain groups of people can go to town, get your groceries on this day, then you come back. And if you stayed over, you had to isolate yourself for weeks at a time. I mean, it became that strict. So very tight knit communities from all across, in Native country.
Yeah.
So.
Yeah. I was gonna hit on some of the stuff that everybody has kind of said, because I feel like we're also similar in how things have happened throughout Indian country. Like Randy said, when it first started, I had a friend that came and she brought me some medicines, some plants, and to make into teas. And she's like, you need to drink these, you need to drink these, you need to drink these. And she brought me enough so that I could make mason jars full of this tea to give out to other people. And so that was one of the ways. I am an individual in the Oneida community, one individual that really helps out with funerals. And that was a big one for me as well, not being able to help families in with that. Like Lance was saying, the Pueblo people where we had those roadblocks. You had to show proof that you were a resident in that area, especially like with mine. They were not allowing non-tribal members or their spouses into the community. People that lived out of state were not allowed to come into our community, into our Pueblo. So I have not been home now in over a year and a half back to New Mexico, where I went every December and then again in June to attend our ceremonies. And so I haven't seen my family in over a couple of years, well, a year over year. And, we were very fortunate in that just my brother and my nephew, excuse me, the light's gonna turn off here. No activity, it turns off. They were the only two individuals in my entire family that had contracted COVID, and they actually both live in Texas. So, our family, we really tried to protect, to make sure that my parents didn't get it, our grandparents didn't get it. My Pueblo was one that really helped out in that we own a big hotel, and they used our hotel in the state of Mexico as a place where other Pueblo people could could go to quarantine to get tested, so that if they have family members in their home that are sick or elderly or whatever, could go to our hotel and stay there. There was no cost to these families. And that really helped out a lot. They had thousands of people, other Pueblo people that stayed at these hotels, or at this hotel. And so my tribes have been an intricate part of what happened, like making sure that Pueblo people were safe there. We were the first ones to have shots in our area to provide to families. They continue to do testings for everybody else there. Yeah, the roadblocks are a huge thing. They were so very strict on that. They still are very strict on that. I really want to go home to see my family, but if I do, my family's going to have to come to me someplace at a hotel or someplace, because I won't be allowed back I won't be allowed back or in the Pueblo. Again, if you traveled someplace else and the tribe found out about it, you were stuck in quarantine in the hotel for 2 weeks, so that you were not bringing it back into the Pueblo. So that was a really big thing for us. I also sit in the Longhouse. I sit with the Bear Clan as well. And to not be able to have those connections, not to be able to have those ceremonies. When I'm not able to get back home, the Longhouse is my refuge. That's where I go for ceremonies. And so to not hear the songs, to not have the ceremonies, to not have the normal things happening every year, that hit big. So yeah.
Yeah.
I see did you find resistance to virtual communication by your community? Actually, I can kind of speak to this. Oneida was very well in getting a Zoom meeting set up virtually to kind of provide information to the Oneida people. So they had like a Zoom call. I think it was like every Wednesday, or they still do it every Wednesday or something, but they were able to provide a lot of information that way. And also my tribe back in New Mexico, they had a Monday meeting virtually. It was really hard for elders to try to get on that and learn that, but with a little bit of assistance, they were able to do that. And so now it's one way that we use that's effective to be able to get on and communicate with other family members or other, meetings and our tribal meetings and stuff. So
I found that too. I usually have an evaluation. I was a mess trying to teach virtually and thought it, wasn't done very well. I'm really hands-on. Like I said, I have a lot of demos, and then evaluations were like, hey, I liked it. Great job. I like virtual. And it was usually that younger generation. They could just open their laptop. They would, tune in from their phone. So I really think it was age. And then now we're finding even like people who are able to work virtually, which I never had, only when I was in quarantine. So people were like, oh, I'm home, I'm working virtually. There's a huge amount that don't want to come back to work, so being by their kids, one of my relatives had a baby. She had this long extended maternity leave. I was like, oh my God. So, the silver lining for some people is, being able to be home more, if that's kind of your, some people are like, I don't like people anyway, so I get to be home. I'm okay. Those people were A-okay during COVID, but a lot of us really struggled. And me, I walked out that door since March, so I don't really know any different. But virtual, really for me, it was the age. And then Oneida Nation did a really good job. I don't know what her public relations, we have a public relations staff person, and she had Facebook Live. And then she would invite in medical people. And now it's about programs that are slowly starting to open, and people are so appreciative of that. What are the numbers? What is the status on COVID? What are the resources available? Not to be funny, but is bingo open was a common question. And then now it's like, is the fitness center open? So just getting those messages out there, and people can tune in from their phone. So that, technology has been, really fantastic in our community.
So I've heard a couple of mentions to this. We know that COVID is particularly impacting elders in our communities. How is that different for Native communities than it may be for other people, to have a disease that really is very much impacting older people?
I don't think that, people are people, so it's gonna impact all of us, individually. But as Native people, Indian people, our elders are very sacred to us, and they hold a lot of knowledge. So it's in our best interest, and it's important for us to want to take care of them. So you see a lot of people not going to see their grandparents. Again, I have not seen my grandparents in a long time, and because you want to protect them, you want to make sure that they're okay. And so, but at the same time, they're being isolated because people are not wanting to get them sick. So, but I don't know that it's any different for any other elder that is not Native.
No.
I think we're all people.
Yeah,
so.
I think she was just speaking to say those, we talk about blood quantum. They're always saying, the last full blood passed away or the last fluent speaker passed away. I mean, the elder, like she said, in almost all communities are, our gems and our, archivists, the ones sitting with us. Yeah, we were so sad to hear with, I had the statistics from our HR. So we have, we only lost, laid off, furloughed about 700 staff through COVID. And we had about over 2,000 employees, and then about over 1,000 are enrolled Oneidas. Half of our workforce are Oneidas. And then with the closure, obviously, like he had said, those with tribal contribution got closed, and it was really unfortunate. It was our cultural wellness center where there were Indigenous healers, the culture archivists, all those things. So that was really a hard hit. I had usually I work with moms, and if they have a history of depression or looking into counseling, I'll say, okay, here's our Oneida Behavioral Health. This is where you can go if you're looking for alternative things. And a lot of them really seek that. I was getting a really good feedback from them is saying, I'm done with counseling. I tried that. I don't want meds. I've tried it. They're looking for something else. I have so many moms coming to me saying, how do I get my Oneida name? How do I find out which clan I'm from? And usually I would refer them to the archivists and people at, the culture heritage, which is no longer there. So we talk about loss of identity. We made slow gains. Now we're kind of back to where we started, unfortunately. So we got to get Randy full-time again for the future.
Oh. Yeah, that's another thing there too, was the medical and the, our teachings are not our knowledge keepers of medicines. And there has been discussion in the past, and there's been some current discussion with the medical about, because I would get referrals from the doctors every now and then, that somebody wants to use more traditional medicine, like Candi was saying, that pill just isn't doing it, and at cultural wellness, they did a lot of that, that was their thing. So, there's like a window of opportunity here too, because of COVID, to open that door wider. Because myself and another a person we do these cultural trainings over at the health center, and they take a day off and just do cultural presentations, with the whole staff, and so they had all these videos that they would have to, it was required, this is us. And so I think that's been going on for a few years, and I think that's kind of the springboard to bring that together even more. This is what COVID has done. And I've been telling different doctors about that medicine that I know, and they're curious, well, what's in there, and it works. To me, it works. Just based on the people who used it, it works. And there's a lot of medicines out there. And so this is all the knowledge that's coming back. I mean, there's been studies been done down here and with the tribes here in Wisconsin in the 20s. There was a botanist that worked for the Milwaukee Museum, and he came here in 1929, and spent that summer off and on coming here and touching base with different elders at that time, and my grandpa was one of them, and collected over 200 different plants on the reservation here, and so it has the Latin name, the common English name, and then what we called it in our language, and a little blurb, this is what you use it for, and so I was fortunate to be able to work on that, because all the other collections were presented as journals, but ours wasn't because he died shortly after. And so there was a professor from Kansas State that reached out to the tribe, and he wanted to have that published. And it came to me. And at that time, this is over 20 years ago now, I had a group of elders, we call them dodos in our language. You know, it's an affectionate way of calling your grandma or grandpa. You know, in our community, it's mainly attached to grandmas though. But other Iroquois communities, they do it for grandpa as well. And so we were able to go through it because the writing system that he used was the one that was used when our people came here. It was more of a phonetic type of an alphabet, and that's the alphabet that he used in that document, and he wanted to flip it into the standardized Oneida language alphabet that was created back in the 50s. No, actually back in the 39, 40, and in the 40s, you know, that we use today. And so that's something that, you know, that I've always been interested in, you know, is that medical stuff, you know, the plant world, you know, and so you know, there we have these researches that have been done in the past that we can turn to, as well as the oral. I mean, every family has something, you know, some kind of a knowledge, you know, about the medicine world, you know, and sometimes people are afraid of putting that out there because, you know, how our people have been minimalized, you know, and that our stuff is, you know, inferior, you know, and so, you know, we have to educate our people and get that pride back in them, that, you know, about their identity. And because of the acculturation that has gone on, it's so changed our people, you know, but at the same time, we've always had people who had that and wasn't afraid to share it, you know, and stood up, you know, and shared that knowledge. And so we had a number of those people in our community too, because we still have our language. You know, if that didn't happen, we wouldn't have our language here in our community. And you talk about total assimilation, you know. Yeah, we wouldn't have no identity. But it's like that, you know, all over in Indian country.
So we've got just a couple of minutes left. So I want to say a huge thank you to all of our participants for being here today. I really very much appreciate it. We've got some comments as well of thanks for being here and being open and willing to share your experiences. I think that this is a really great kind of way to end this as well, of being able to highlight that this has really been an opportunity in a lot of ways. And while it's been terrible, and certainly like we wouldn't wish this on anybody, it's been a really great opportunity for people to be able to reflect and learn and sort of return to some of those pieces, some of the cultural heritage pieces, as you were speaking about, Randy. So I very much appreciate that kind of a comment and piece of things. So again, thank you, Candi, Randy, Tanya, Lance. Thank you so much for being here today. Thank you for sharing your experiences with us. All of you out there in the universe watching us, thank you for being here with us today and joining us on our mission here at YWCA Greater Green Bay to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all. And again, as just a reminder, we've got 2 bonus webinars for you coming up later this week on Friday afternoon. So you can find those on Facebook or on our website for the links for that. I also popped them in the chat at the very beginning of the chat. So you can find them there as well to be able to sign up for those. Really connecting racism and public health. We've done a ton of work this last year with our Stand Against Racism series, really looking at racism and health and how those pieces fit together. both with these conversations about COVID and also with our conversations about structural racism as well. And so these are some really great opportunities to be able to kind of further that connection and understanding around racism and health, and what some different perspectives are from different sectors out there in the world about how we can start addressing and continue addressing racism out there in the universe. So again, thank you all for being here with us. Make sure you check those ones out. And if you have questions, please do pop them in the chat real fast or shoot them over to us. I think our email address is in kind of all the stuff that you saw. Pop them in the comments on Facebook. We'll get to that as well. So again, thank you, everybody. Have a fantastic rest of your day. And we hope that you join us again next time, including on Friday, for some more of these conversations. So thanks, everybody.